We were going to do as Whipples. I thought, let me summarize Whipples, try and do it in 2 to 3 minutes for all my colleagues and my students. You see, Whipple's a very big name, a pancreatoduodenectomy, and considered to be in the minds of every surgeon, kind of the biggest surgery, surgical oncology or general surgery or GI surgery. But let me tell you, besides the choreography, besides every little step that you think about, what is it all about in essentially two things. One is exposing or approaching the tunnel of love, and second is the reconstruction, and the reconstruction essentially about what to do about the pancreatic stump. You may put it in the jejunum or you put it in the stomach. I like to put it in the stomach. Well, so how to approach the tunnel of love? Love is not the name of a surgeon. Tunnel of love is how your two fingers meet behind the neck of the pancreas. So do it lovefully, do it carefully, and once your two fingers meet, that means you're able to expose the SMV inferior to the pancreas and the portal vein superior to the pancreas and anteriorly make the two fingers meet. Your resection is practically done. And now how to do it? Let me summarize that for you. Inferior aspect of the dissection, that means exposing the SMV inferior to the pancreas. How do you reach that? What is it on the way? Enter the lesser sac from the left side and pick up the hepatic flexure and the ascending colon a little and reach the SMV and the trijunction. The trunk of Henle would be there, ligate that, and the SMV has been exposed anteriorly. If you divide the stomach also using one single stapler fire, that will make things even easier. The exposure will be larger. So divide the stomach early, enter the lesser sac, bring down the hepatic flexure, reach the trunk of Henle, divide it, SMV is freed. Superiorly, you would have already checked that your common hepatic artery anatomy is the conventional sound one, that there's a common hepatic artery, it's going to right and left. So you don't really need to bother much about exposing the common hepatic artery distal towards the liver. So you already know that the anatomy is fine. So as you expose the common hepatic artery, the GDA will be visible. Divide the GDA. And now to do the cholecystectomy, divide the CBD. So behind there is the portal vein. So portal vein and superiorly has been exposed, anterior aspect of it, and inferiorly the SMV has been exposed. Meet the two fingers and actually most of the job is done. Now coccerize. Do a wide coccerization from the hepatoduodenal ligament down to D3. Pick up the the duodenum superiorly, anteriorly, and bear the D3 posteriorly and anteriorly as much to the left as possible behind the SMA SMV. And now you're ready to divide the jejunum and bring it down this side. Now what is left is separation of the uncinate process from the portal vein. For that, the trick is pick up the portal vein. Don't yank the uncinate out. Pick up the portal vein and you will see the small branches, 3, 4, 5 of them, and you can pass ligatures 4-0 silk around it, and the specimen is out. Now the reconstruction bit. Mobilize the stomach, the pancreas stump well. Divide the pancreatic stump any which way. If you're like I do a pancreatogastrostomy, so don't bother about how to divide it. You can divide it with harmonic or divide it with cautery. And it doesn't matter whether you see the pancreatic duct or not, because if you divide it with energy instruments, you may not be able to see it if it's a thin one and the pancreatic substance is fibrotic. It's good if you could locate it, because if you should put a stent inside it. So mobilize the pancreatic stump well, about 2 inches, and open the stomach posterior wall, 2 finger breadth vertically, and pull the stump in a little, and you know slip the the wall of the stomach over the pancreatic stump and tighten the purse string. You already have taken a purse string around that hole that you've made. Tighten the purse string, not too much, just a little, to keep the stomach opening snug around the pancreatic stump. And then take 4 stitches of you know 2O PDS to anchor the stump into the stomach. And I think most of it, the job is done. Do a hepaticojejunostomy, then do a gastrojejunostomy end to side, and do a feeding jejunostomy, and start closing the abdomen after leaving specifically 2 drains behind the stomach in the region of pancreatogastrostomy. One is a flat drain and one is a Romovac drain, and then a drain here and there wherever you feel like, and you're through. All the best. Anyone who wants to do Whipples, keep these 2 things in mind. One is a tunnel of love, and the second is your pancreatogastrostomy, which I do, or you may do a pancreatojejunostomy in whatever which way you are comfortable. Thank you.